Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. My guest today, Dr. Daniel Hatch, is a successful podiatric physician from Greeley, Colorado. Dr. Hatch has been a longtime leader in podiatric medicine and has given back to the profession in many ways. For example, Dr. Hatch served as the president of the American College of Foot and Ankle Surgeons from 2007 to 2008. He was also on the board of directors at ACFAS from 2004 to 2007. Currently, Dr. Hatch is a board member for the International Foot and Ankle Foundation, and he serves as faculty for the American Academy of Foot and Ankle Osteosynthesis, and he's the surgical director for the North Colorado Podiatric Surgical Program. Dr. Hatch and I co-founded the North Colorado program together over 20 years ago, and we did it with funds, Genesis funds from the Scholl College of Pediatric Medicine. And so we'll talk a little bit about that. Dr. Hatch is no stranger to scholarly work. He has 36 publications to his credit, and if that's not enough, he has 3 patents in his name, one for Lapiplasty system, the other for screw fixation from an opposite cortex, and a 3rd patent for bone positioning guide, which we'll talk about a bunch, Dr. Hatch. Welcome to Dean's Chat.
You know, Jeff, it's a true honor. I saw some of your other podcasts, and I'm just honored to be part of this great company you've assembled to do this. So congratulations, and it's my pleasure.
Well, thanks, Dan. A show like this is only as good as its guests. So here we go. We'll get started. So, right. Dan, we have an informal kind of environment on Dean's Chat. So let's just go with Dan and Jeff. And
you got it.
All right. Sounds good. Well, you know, I think the best way to start this is the latest and greatest. You know, I can't go anywhere without seeing Treace Medical and the Lapiplasty procedure being advertised. For example, at the National Pickleball World National Championships, they had a Treace Medical tent, and it was almost like got bunions. You know, they're talking about different ways to help active people. Mm-hmm. Can you talk about your patents? And your first one was the Lapiplasty system, correct?
Yeah, that's correct. This all started back in 2014. John Treace and I had a discussion, and we brought in a team together. There was 2 orthopedic foot and ankle docs and 2 podiatrists, Paul Dayton being one, Bob Santrock, and Brett Smith were the orthopedic foot and ankle guys. And I'll never forget this meeting. We met in Memphis, and John kind of said, well, what do you guys think? What's your most rewarding procedure, but yet challenging? And that's the genesis of what we did. So we were a collaborative team that got together. And to me, that's one of the most exciting things, is to meet on a regular basis, trying to make a product, trying to make it better and innovate, and trying to make it reproducible so the masses could use it and get good outcomes. So that's really the genesis of that. So it's been 9 years now.
That's incredible. So necessity is indeed the mother of invention.
Correct.
So let's talk about those 9 years, because a lot of times I get emails from docs around the country, and a lot of them are younger docs, and they're looking at different ways that they can invent a product to make the world a better place. And I don't think they have an appreciation for all the work that goes into not just developing an innovative idea that's patentable, but actually the process of taking a product to market.
Yeah, there's several ways, as you know, you've done it as well. You know, with Treace, they had their own patent attorneys, and we were a team, and you assign your rights. And if you do well, you can get a small % royalty of the product. That's probably, I think, the easiest way to go, really, if you have an idea. The harder way, I had a couple other designs. One is and you don't know about this, but I designed an arthresis product with Tom Chang and Jeff Christensen years ago. And that also was company driven. And I've tried to do this fixation from the opposite cortex, working with different people. That's another patent that I have. I did that in conjunction with another company, but I started on my own. Now, the risk reward of this is, if you do it on your own, that's great. You can financially do better, but it's also more costly up front. You have to get a patent attorney. It can be a very laborious, expensive process. But if you have a patent, you go to a company, you're financially much better than just an idea that you share. You can do that with a non-disclosure agreement with companies and share ideas and get along. That's, again, financially the easiest way to go, because I think the younger practitioner, let's face it, you got loans, and financially it's hard to do. So it's all about making connections with people, ties with industry and leaders and product development teams, and working along those lines. But again, if you get on a good team, it's especially later in my career, one of the most exciting things that I do, and it's kept me going.
No, that's great. So 9 years ago, when you got together, you said it was Mr. Treace,
yeah.
And how did that system work out? I mean, did you have monthly meetings or weekly meetings just to get the ideas and put it on paper, or did he bring his engineers in immediately?
No, we were just a mom and pop shop back then, and it was just the four of us brainstorming. So we do a lot of cadaver labs. I think we fixed all the bunions in the cadaver arena. There's no more left. We would meet at least every other month and get together as a team and try to innovate and work out. We went through so many renditions of this product. And it's nice to look back and kind of laugh at like, oh, what? We tried that and it didn't work. We tried this and it didn't work. And it's just was a lot of trial and error, but perseverance and working with a good team is really paramount in getting things done.
Absolutely. So, Dan, in just like an elevator pitch, can you tell us about the Lapiplasty system for people that don't know about bunions and what they're about? What exactly? What is it all about?
Well, we felt that the Lapidus was one of the most powerful procedures, but at the time, it's kind of hit or miss. You would make your bone cuts, and we call it. You would take a leap of faith. You would make these cuts and try to realign it. Some days you'd be on the mark and do a good job. Other times not so, and then you'd putz around with it and try to get as good as you can. But that was really the start of this whole system. But the concept behind Lapiplasty is really correct and then cut. We correct the deformity through different apparatuses and then make precision instrumented cuts. And we've done many articles on this showing very low, small shortening of the first ray. Triplane correction was really the genesis out of Treace. Mizuno did this years ago in the 50s, but like a lot of things in medicine, it wasn't really caught on until the last 10 years with the advent of 3D CTs. And with 3D CTs, it's really shown that there is that rotational component that we, for years, me included, didn't take into account. You would look at a two-dimensional X-ray and make your cuts along those lines, but we forgot about the frontal plane. And I think of anything that we've done, there's been a lot of copy systems out there since it's come out, even though all this stuff is on patents. I think Treace has over 23 patents altogether presently. But I guess, copying is the greatest compliment, right? It's introduced into the profession, both ortho, foot and ankle, and podiatry, that you do need to take into that triplane component in bunion correction.
Well, like you said, for years we've looked at the sagittal plane, and for years we've looked at the transverse plane, and now we have the ability to correct and objectively see what we're doing in the frontal plane.
Right, and that's been the neatest thing to see. Like I said, there's a lot of competing products now out there, but to have people understand that, and it's all about making your patients better and getting good outcomes. So sure, I have a bias towards Treace, but if somebody's taking that concept into mind and helping their patient, then that's rewarding also.
That's awesome, Dan. Well, the hallmark of innovation is a USPTO patent. So I congratulate you for getting 3 of them.
Thank you.
Well done. So you've got education in your blood. And I thought maybe we go back and talk about the early days. Dan, when did you decide you wanted to be a podiatric physician?
Oh, my word. This is going to date myself, but Jeff, like a long time ago, I knew I wanted to help people. I think you have that in your nature. I saw podiatry as a way to do that and do reconstructive surgery, which was an interest. And hopefully not stay up or get up in the middle of the night. So I chose those three attributes. Now, that wasn't always the case in the early days, as you well know, dealing with the diabetic population and infections and so on. But you and I started a lot of things together. The residency, I think, in 2001, and then you also helped the genesis of the wound center at the hospital that we started, and that's still all that's still going to this very day and doing very well and thriving and being very active. So you're right, education. The common theme, and when I go around the country with talking to people, lecturing and doing things, it's like you want to help our profession and help those behind you get better in a quicker way and not make the same mistakes that I did.
Oh, well said. Now, you went to the Scholl College, right?
Absolutely.
Well, and it was the Scholl College.
It was Illinois College of Podiatric Medicine. It was on North Rush Street, in Chicago, downtown. And one of the nicest things about it, we had a great clinic. And so we were, as students, we were doing surgical procedures and helping people downtown, North Dearborn Street. That's where it was, next to Rush Street.
Well, then it's no surprise, really, when Dr. Albright and Dr. Todd called us and they said, if you guys are interested in starting a residency program, we've got some residency genesis funding that we can put behind it. And you and I jumped all over that. And that made a lot of sense.
We did. It was, as you know, a lot of work, a lot of paperwork, a lot of grinding to get it done. But thankfully, we had great candidates in our program to make it even more successful. I mean, you and I started all the administrative things, but our residents, Eric Jacola, Anna Weber, Matt Dearman, these are all fantastic people doing extremely well in the profession. And as you and I sit here now, that's probably one of the more rewarding things. I'm a past residency director. Now I'm director of surgery, but it's to see people graduate and become successful and carry that baton forward.
Dan, I didn't realize it at the time that was going to be one of the most important aspects of my career, starting a residency program. And now, where I sit now as the dean of one of the colleges, certainly the unsung heroes in our profession are the residency programs, the directors, and all the attendings that are bringing their cases and training up that next generation of podiatrists.
Absolutely. I think it's easy to take that for granted, but whatever position you're in, you dedicate a lot of time. It's time away from family, personal time, and you're doing it to really help the profession grow and become even more successful.
No doubt. Little side story. I was down in Waco, Texas, and my son was graduated from Baylor. And as I was pulling up to the hotel, there was this big building, medical building, and it was Neelan Willingham's foot and ankle clinic.
Wow.
And I checked into the hotel. I walked across the street, it's a beautiful facility, and I met the front office assistant, and I asked if Dr. Willingham might be available to talk, and he gave me a tour of the whole place, and I was very, very proud of him that day, Dan. I was so excited for him and what he had put together in Texas.
Yeah, that's what it's all about. It's at this point, again, in our careers, that to look back and see people become successful and do well. And I think they've all done well out of our program. So thank you, Jeff, for your impetus and help in getting that going. It's been a good ride.
Oh, yeah. It was like the ultimate team effort for sure.
Yeah.
Hey, Dan, let's talk about other residency training. When you came out of school, out of the Illinois College, you went to one of the most premier surgical training programs in the country at the time, Highlands Hospital. Can you talk about that?
That was just a gift. It changed my life, obviously, because that's what got me to Colorado. My mentor, John Buchholz, was extremely well respected in the field, still is. One of the greatest intellects and researchers that I've come across. And we have people like that we can thank. And John helped me to think critically and not take things for granted and always question what you're doing. And I just think that was a great experience. So back then, some history there. very few residencies for us available. This was just a one-year program, but in Denver, hospital privileging, that's another subject that maybe we could get into, but it wasn't that plentiful. It was restricted for podiatry at the time. So everybody came to this one hospital in Denver. So my surgical caseload was, excellent. I did so many in that year and worked with a lot of great people. So Colorado was great. I went to work with John Buckholz and Jim Griffin for a year in Denver after that. And then I started my own practice in Greeley. So I've been around here a long time.
No, you have been for sure. I had a similar experience in Detroit, Michigan. I went to Kern Hospital. And
Right.
when I went there in the early 90s, Dan, I think we had over 100 attendings bringing cases to one hospital with 3 ORs going nonstop all week. And then hospital privileging came into play, and then doctors started staying closer to home where their offices were, and they'd get hospital privileges, and that kind of started to shrink the numbers. But at the same time, it expanded the profession immensely, throughout
Right.
Detroit. I think the same thing kind of happened in Denver, right, and in Colorado in general.
It did. I was part of that. Back in the early 80s, again, there weren't that many hospitals available for podiatry. So I had, I guess, let's just call it a discussion with our local hospital, and we resolved our differences. And ironically, when I first came into town, they didn't allow any podiatry privileging. The irony behind all this, that's the very same hospital that you and I started the residency program.
Go figure.
So it's been great.
Oh man, times.
Everything's open up around the state, like you said. But the caseload at these places and the amount of podiatrists, people are still getting great experiences. But you and I were fortunate to have that concentrated experience at that point in time.
Right. I think we're indebted to the generation just before me. And I think that you caught the tail end of that, because when I moved to Denver in 93, all I did was fill out an application, put it in, and I was given privileges. And it was not even an issue. And so our entire profession stands on the backs of all of you that made it happen at hospitals and paved the road. So thank you.
It was a struggle back then. Just historically, a lot of people did surgery in the office, as you may know, and I'm sure in Michigan where you did your training is as well. And now that's pretty much unheard of, except for minor procedures. But it's come a long ways.
It has for sure. Dan, let's talk about you giving back to the profession. Not only did you stay local in Colorado, you've been very active politically there, but you got on a path to become the president of what is really the premier educational entity in our profession, the American College of Foot and Ankle Surgeons. Can you talk about that journey? How'd you get involved?
That's a good question, Jeff. And I never had aspirations to become president. When you volunteer, like in the state, I was on the regulatory board and the state board, state society, and president of both. And it's just a way of giving back and get involved. But it's the old adage, the more you give, the more you give back. I know that may sound corny, but it's very true. I have loved all those experiences, and I feel I've gotten relationships like you around the country with great educators and people. If a resident needs a job, I can call anybody at any time, and these are leaders in our profession. So it's been a privilege to get to know them. But I initially started with ACFAS years ago, just volunteering to be on a committee. That's how it starts. You maybe be on an educational committee, and then you do well, and then you get acknowledged, and then you're made chair of that committee. And then it just moves from there. Then maybe you're on other committees, and then you get a position on the board. And I was just thrilled to be on the board and participate. But I think when you work hard and show your dedication and desire, it gets recognized. And that's what happened. I was asked to move up to the executive committee by actually Gary Jolly, who's passed, another just a fantastic educator in our profession. And these are things you never forget. And it was just an honor and a privilege to do it. And it's it takes some work, but again, I feel very confident that the amount of time I put in, it's given me back. It's been very rewarding.
That's great. Every year we have different clubs at the college, and ACFAS club is the most popular for sure. We bring in great speakers and labs and things, but students are always saying, I want to get involved, and how do I get involved in the future? Can you paint a picture of what it's like to be the president of ACFAS? What was that year like, Dan, for you? Because I remember we were working together at the time.
Yeah. Well, it's busy. I mean, you dedicate your time, but it's rewarding. I think during that tenure, I initially wasn't comfortable doing lectures and speaking, but out of repetition and throwing you both feet in the water, so to speak, becomes second nature. So you don't need to tell your students that aspire to do that. I think they have to have those attributes. That'll come. But it was a great year. And again, I think the rewarding thing to me is just meeting people around the country and meeting people in industry. And we all have the same goals and aspirations to help our patients.
It's interesting because I did one of these Dean's Chats with PJ Andrus and Eric Barp, who's the current president. And everybody says the same thing. It's the people you meet. The more you give, the more you get. I think that's a common theme in a small profession, or maybe any profession, when you're giving back to make it better.
It is. And to tell your students or anybody listening to this, I mean, it's just baby steps to get involved. Just volunteer to be on a committee. It's not like you just get on the board. And I mean, it does take time, especially ACFAS. I was probably with them for over 8 years and then going through the chairs. But just giving back, it's small steps, but just get on a committee and get involved. And even at that level, when you do, you still meet people. And I've learned even academically and surgically things sitting around like this at the fireside, so to speak, that lectures, you get some degree of education, but meeting people around the country, you pick up pearls, and it's always been a continuing educational process.
It has, for sure. Dan, you had mentioned early in our discussion today that one of the reasons you went into podiatry was so that you could sleep at night and do things other than medicine, perhaps, with your valuable time. You've got the perfect work-life balance. I've watched you for many years, and you know when to work and when to play. Can we talk about a couple of your passions? I know one of them is biking, and you've done some incredible bike rides. Can you talk about that a little bit?
Yeah, cycling's been fun out here. I got involved mainly because I had a bad knee that ultimately went on to a knee replacement. Your past partner is just going through a knee replacement.
Yes, he is.
Dr. Chipola. So it happens when you're active, but Colorado fosters that outdoor environment. And that's one of the first things that I noticed when I moved out here from Illinois. And that's very contagious. And so you get involved in outdoor activities. And cycling was a way for me I was a runner, but then the knee gave out. So cycling was the next best thing, to be outdoors and do that. And I've done some long distance things that takes time to train. The triple bypass, it's called, is 120 miles up in the mountains, 3 passes. And I've done that about 8 times. And I enjoy just being outdoors and doing that. So cycling.
I think whoever coined that term, the triple bypass, it's one of the greatest names for a race anywhere. But can you talk about the passes that you ride over? I mean, you're up at 11,000, 12,000 feet, right?
Yeah, you start out at Evergreen and go over Squaw. Then you do Vail Pass, Squaw, Copper, and then Vail. So
wow.
It's
how fast do you get going on the downhills?
You can get up to, I put the brakes on. I'm not crazy as some of the younger cyclists. I see them zooming by me, but I'll get up to 40 miles an hour. That's about my limit for safety.
Yeah, I hear you. I took a spill on Squaw Pass when Dan McFarland and I were up biking one day, and my shoulder has never been the same, to be honest with you.
Yeah. Actually, I made a mistake. It's Loveland Pass, so it's
okay.
Up in Vail. Yeah.
Oh, okay. Fantastic.
Yeah.
So then the opposite of being in the mountains is being on the water. You're a fairly accomplished sailor also.
I took up sailing years ago with a dear friend of mine. He was a neighbor. He moved to Wisconsin, but we started up at Dillon Lake, and there's an old thing about sailing. You're familiar with that. You had a boat up there. They say if you can sail Dillon, you can sail anywhere because of the swirling winds. And I started there. Then we went out to San Diego to learn from different instructors out there. And now I have it's like a 104 certification with American Sailing Association. So I can charter up to a 50-foot boat anywhere. And my favorite is to go to the BVI, British Virgin Islands, and just hang out. And you wake up and you go, well, what island do you want to go to today? So that's been very, very fun.
You're bringing back some scary memories of sailing on Dillon. I remember the wind does turn on a dime, and then things are a little bit out of control for a few minutes.
Yeah, that can happen. I'll never forget. It's called a jibe, when the wind just shifts and catches your back sail. And I wasn't prepared for that. Thankfully, we had an instructor, but we were starting to tip and go over. And you never forget how to handle things like that. And thankfully, the instructor just pulled the sail and let it loose and let the wind go, and we were safe. But it was a little scary at the moment.
It's a classic example of it's not what you do, it's knowing what to do at any given time.
Yeah.
Well, very good. So you have a new passion, I understand. It's photography.
Well, new in some regards. I've been doing it for years. I started this with another colleague who you may recall, Pete Hartlove.
For sure.
He was my co-resident. And back in the day, he got me involved in scuba diving. So that's actually where I learned how to do photography. I got my own equipment and learned how to compose. This is back in the film days. This wasn't digital. So you had to get what you shot is what you got. You couldn't manipulate it or do much. So I learned there. And then I got into landscape and done some animals, polar bears. I've gone up to Churchill, Manitoba and photographed polar bears up there. And I got another trip coming up. It's called The Wave in Arizona. It's such a popular place. It takes a lottery to get in there, and I finally got it. And I'm going next month, so wish me luck. I hope there's not too much snow. But I liked it enough that I became a certified professional photographer. I took the exam. They have an examination and a practical where you have to send in pictures certain ways, and that was fun. It kind of tested my knowledge, and that's a recent kind of certification that I have. So photography, I love. It's a beautiful activity.
That is so neat. I don't know if you remember, but in my office in Denver, we had Ansel Adams pictures all over. And maybe you're the next Ansel Adams yet, Dan. You haven't finished all of your accomplishments yet.
Oh, we'll see. But it's fun. I enjoy it. And it's like, it's nice getting out in nature too. I mean, it's not just shooting. You're hiking to a spot, you're composing it, you're getting the shot, and hopefully you're in the right time and place and working with it. So yeah.
Well, that's great. So Dan, as you know, our profession has had a pendulum swing over the years. Back in the early 2000s, we had shortages of students compared to residencies. And then about 10 years ago, we had more students than we had residencies. And now the pendulum has swung all the way back where we've got plenty of residencies, wonderful training opportunities for students, but our applicant pool's taken a dip. What would you tell a prospective student that's contemplating a career in podiatric medicine?
Jeff, that's a great question. I look back at this. Now I'm the old guy. I don't know how that happened, but I've been practicing now over 40 years. And I absolutely, unequivocally have no regrets. I've enjoyed this profession so much. It's given me so many opportunities, professionally, financially, and spiritually. I highly recommend it. I have no doubts, and I would do it all over again. So anybody starting this profession, I highly encourage them to proceed with their dreams and keep going, because it's been fantastic.
I feel exact same way, Dan. I wouldn't change anything about my career, and I'd go into podiatric medicine again in a heartbeat.
Absolutely. It's another thing we didn't talk about that I enjoy is, well, it's through IFAF, International Foot and Ankle Foundation. They help sponsor the Yucatan Children's Project.
Yes.
And I go there twice a year, and I take our residents, your residents, your past residents, and it's a great experience to give back and see what it's like when you don't have all the instruments and availability in our ORs in the United States to get a job done when you have to get it done, and you aren't spoiled with all the stuff we have here. So you got to make do sometimes and think on your feet. So, and helping the children down there is great. A lot of them have physical maladies that are shunned by the family, So if we can help them straighten out their lower extremity and become active again, it's also very rewarding. So that's been a good thing too.
You've been down there a lot, Dan. How long have you been involved with that?
Yeah, probably 20 years. And it's been great. Again, look, I meet people down there. We have a pediatric surgeon that Dr. Rocha, who follows the patients afterwards, and getting to know him as a friend, and other people that come. I meet people from Barry University who attend while I go as well. So our Colorado program meets with Barry, who's the overall sponsor. And I got to give a shout out to Dr. Sutherland, of course, who started all this. And he had the foresight to create it and help people down there. So Chip, as we know, we're all very thankful for him getting this going.
Absolutely.
And it's the Barry University who sponsors it.
Initially, Dr. Sutherland or Chip called it the Yucatan Crippled Children's Project, but recently it's been renamed. It's named after Dr. Sutherland, because you're absolutely right.
Yeah, he's a great man, and talk about somebody that gives back too. So see, it's things like this, Jeff, that we talk about, that without giving back, I would have never met Dr. Sutherland, and having that experience with the Children's Project. And it's, you get back 3-4 times.
Absolutely. Hey, I wanted to ask you a question. Can you share with our audience, and I have the same feelings, but what happens when we bring in a student from one of the colleges of podiatric medicine and they begin our program as a first year, and then 3 years later they graduate as a doctor of podiatric medicine with 3 years of training? Can you talk about that transformation for a few minutes? Because I think it's astounding.
Well, it is. When they first come in, as you know, most programs deal with the didactic parts and rotations. So I don't see a lot of the first years. Most of them get involved in their second and third with me doing the surgical cases. But to see the transformation when they start and their knowledge base increase and their confidence build up is what's very rewarding. By the time they get out, my third years now are just fantastic. They're smart, they're dedicated, they're good surgeons, and it makes me just proud. I would let them work on my family members and stuff, and to get out with those skills over 3 years is amazing. A lot now are going on to fellowships, and I don't know if you want to get into that or my thoughts, but I think it's good, especially if you're in a urban area, academic arena. I think to get a fellowship is good. That's just my Dan Hatch bias. If you're more rural and you're well trained, that's fine. But I see an evolution that fellowships are becoming more important and helpful.
Yep. And I agree with you. And you're right. That is a topic of discussion all over. And it has the whole gamut, Dan. There's some residency directors that feel that after 3 years, their residents have everything they can possibly get. And if they get a wonderful job opportunity, they take it. And then you have another camp that says you only have one chance to get more education at that level. Why not make the most of it while you can?
I agree. So it kind of depends on where you're going to practice and what type of practice you want. It's an individual decision, I think, but I see it becoming more prevalent.
Yep, I agree with you. In fact, I've got some interviews coming up with some fellowship directors, so we'll get some more insight into that over the next month or so for sure.
Good.
Dan, I got to tell you, I think starting the residency was so much fun, and there was so much camaraderie was built. I think some of the best times I had in the profession was when you, me, Dr. Jacola, and the rest of our residency training committee would go to Frisco, Texas, or to Chicago, Illinois,
Right.
and interview 40 students for our program.
I agree. That I laugh because those are great memories too, Jeff. We'd work hard all day and interview and meet some great candidates, and we'd go out and have dinner at night. And the camaraderie that we gained with all of us and the attending staff really was the gel that kept the program, I think, together. So that was an important time, but also a fun time. Yeah, it started in Chicago before they moved it to Texas. You're right.
Yeah, those were fun times. And cold, I might add, the second week in December.
Very cold. Nothing colder than Chicago in the winter.
That's for sure. Well, Dan, on behalf of the profession, I wanted to thank you for all the great things you've done and you continue to do on behalf of the profession. What a leader. And what would you tell your residents when they're getting out and going into practice? Little words of wisdom.
Just work hard. It's simple. Do the right thing. My philosophy is always, if you do the right thing and help your patients, then financial rewards will follow. If you do it financially, it's not the right pathway. Yep. At least I feel that way. And work hard and get your, feet in the ground and get base, but then start giving back and start getting involved. I think that's the right pathway.
I agree with you. And I think what you said about the more you give, the more you get are words of wisdom. There's no doubt about that.
Absolutely.
Well, Dan, I'm going to send you one of these Dean's Chat cups because I'm assuming, you drink some.
My whole morning worth my while. This is good because all I got is this little black mug here. So
there you go. Well, I know you take your coffee seriously. So now you can drink out of a Dean's Chat cup. And to all of our listeners out there, thank you so much for joining us today. It was a great discussion with Dr. Hatch, truly a leader in our profession. If you're watching on YouTube, by all means, become a subscriber. And if you're listening on Spotify or Apple Podcasts or Google Podcasts, please give us a 5-star rating. And Dan, thanks again. And to all of our listeners and viewers, thanks so much. See you next week.
Pleasure and honor. Thank you, Jeff. Thank you.
Thanks, Dan. Bye-bye, everybody.